Hello. Welcome back to our channel. Today we will discuss about the four main types of osteogenesis imperfecta. Type 1. Mild OI. Type 1 osteogenesis imperfecta is the mildest form of the disease, and it is also known as the blue sclera type, because people with this type of OI have a bluish tint to the white part of their eyes. This is due to the thinness of the sclera, which is the outer layer of the eye. People with type 1 OI may experience a few fractures during childhood, but they usually do not have any additional fractures after puberty. Their bones may be less dense than normal, but they are still strong enough to support their body weight. However, they may have other symptoms such as joint laxity, muscle weakness, and a tendency towards scoliosis. Type 1 OI is caused by a mutation in the COL1A1 or COL1A2 genes, which are responsible for producing type 1 collagen, the most abundant protein in bone tissue. This mutation leads to a decrease in the production or quality of type 1 collagen, which affects the strength and durability of bones. Treatment for type 1 OI is usually supportive, and it may include physical therapy, braces or splints, and medications to improve bone density. People with type 1 OI can lead relatively normal lives and may not require any special accommodations. However, they should avoid high-impact activities that may increase the risk of bone fractures. Please like and subscribe to our channel and click bell icon to get more health updates. Type 2. Perinatal lethal OI. Type 2 osteogenesis imperfecta is the most severe form of the disease, and it is also known as the perinatal lethal type. Babies with type 2 OI usually have fractures before birth and may be born with multiple fractures in various bones. Their bones are extremely fragile and may be deformed, and they may also have underdeveloped lungs and a small chest. Unfortunately, most babies with type 2 OI do not survive, and those who do have a very short life expectancy. Type 2 OI is caused by a mutation in the COL1A1 or COL1A2 genes, which are responsible for producing type 1 collagen. This mutation leads to a complete absence of type 1 collagen or the production of abnormal collagen, which affects the strength and durability of bones. There is no cure for type 2 OI, and treatment is usually focused on making the baby as comfortable as possible. This may include pain management, respiratory support, and other palliative measures. Genetic counseling may also be recommended for families who have had a baby with type 2 OI to help them understand the risk of having another affected child. It's essential to note that type 2 OI is a rare condition, and most cases are detected during pregnancy or shortly after birth. If you have concerns about your baby's health or development, it's crucial to speak with your healthcare provider as soon as possible. Type 3. Severe OI. Type 3 osteogenesis imperfecta is a severe form of the disease that is usually diagnosed in infancy or early childhood. People with type 3 OI have bones that are extremely fragile and prone to fractures, and they may experience hundreds of fractures throughout their lifetime. Their bones may be misshapen or deformed, and they may also have scoliosis, respiratory problems, and hearing loss. Type 3 OI is caused by a mutation in the COL1A1 or COL1A2 genes, which are responsible for producing type 1 collagen, the most abundant protein in bone tissue. This mutation leads to a decrease in the production or quality of type 1 collagen, which affects the strength and durability of bones. Treatment for type 3 OI may include medications to improve bone density, such as bisphosphonates or teriparatide, and surgical procedures to correct bone deformities. People with type 3 OI may also benefit from physical therapy, bracing or splinting, and other supportive measures. It's important to note that treatment for type 3 OI is focused on managing symptoms and preventing complications rather than curing the disease. People with type 3 OI may have a shorter stature than average, and they may require mobility aids such as wheelchairs or walkers to get around. They may also have other health issues related to their bone fragility, such as hearing loss or respiratory problems. However, with proper care and support, people with type 3 OI can lead fulfilling and productive lives. Type 4. Moderate OI. Type 4 osteogenesis imperfecta is a moderate form of the disease that is typically diagnosed in childhood or early adolescence. People with type 4 OI have bones that are less dense than normal, which makes them more prone to fractures, but the fractures are less frequent than in the more severe forms of the disease. People with type 4 OI may have a shorter stature than average, and they may experience mild bone deformities such as bowed legs or scoliosis. They may also have joint laxity and muscle weakness, which can affect their mobility and flexibility. Hearing loss and dental problems are also common in people with type 4OI. Type 4OI is caused by a mutation in the COL1A1 or COL1A2 genes, which are responsible for producing type 1 collagen, the most abundant protein in bone tissue. This mutation leads to a decrease in the production or quality of type 1 collagen, which affects the strength and durability of bones. Treatment for type 4OI is usually supportive and may include physical therapy, bracing or splinting, and medications to improve bone density. People with type 4OI may also benefit from surgical procedures to correct bone deformities or to prevent fractures. With proper care and support, people with type 4OI can lead relatively normal lives and may not require any special accommodations. Thanks for tuning in. If you found this video helpful, don't forget to subscribe to our channel. If you have any questions or comments, feel free to leave them in the comments section below.